Hi,
Hi, Sophia. How are you?
fine, thank you. And you?
I am very well. Thank you for asking. How's everything been? Good. A lot of study, a lot of.
Yes, a lot of studying and that's it.
Okay. That's wonderful. So let's begin today. You said that you wanted to maybe talk a little bit about the diseases that we were going to talk about, hypertension and
Hypertension and I don't know, another disease. Like, how do you say, like, mordedura?
mordedura is bite.
Like, ¿cómo?
Bite
Bite.
with it. Mhm.
Okay, snake bite.
Oh my God, very interesting. Okay,
Yes.
perfect. Okay, so which one would you like to begin with? The snake bite or the hypertension?
Hypertension. Hy- Hypertension. Hypertension. Okay. Hypertension, hypertension, it's a very common disease in Colombia and in all the world. Uh, the disease is like the high blood pressure, um, like have a lot of how how do you say fuerza?
Force or strength. Force,
Force,
like. Mhm.
force against the walls, against that the artery walls,
Oh.
like walls is como pared, cierto?
Yeah, yeah, yeah. Mhm.
Yes. And and the arteries is like no have the resistance
Mhm.
for that force and cause a health problem. And is determined when when you when you ¿cómo se dice medir?
Measure.
Measure is determined when you measure the blood with
Mhm.
how do you say, like eso se me tensiómetro, no sabes.
Oh, I have no idea. Let me look for it. I think maybe it's a blood pressure monitor, but let me look for the translation because give me 1 second. It is a, yeah, very similar. Tensiometer. Give me.
Similar. Okay.
Okay, so it's measured with the, and a tensiometer. Question, is that like the one that you put that like the pump? Is that it?
Yes,
Okay.
tensiometer. And it's determined when you measure the blood of with the tensiometer, and usually the pressure the how do you say diagnostico?
Diagnosis.
Diagnosis is when the pressure it's about 140. How do you say, like, is 140, pues como
Over.
over over
Mhm.
90, over 90, because when you know it's in medicine we put like this. Entonces,
Okay.
this is like this, esa rayita se dice over, pues como que ahí se interpretaría bien, ¿cierto?
Uh-huh. Yeah. Yeah.
Okay. And when it's several, it's 180, over 120.
That's when it's severe.
Yes, it's good.
Okay. Okay.
These things is very like general because
Mhm.
I want general things, not so profound,
Profundo is deep.
deep, like deep. Okay, and the hypertension, no, is the symptoms is not specific
Okay. Okay. The symptoms. Remember,
because
symptoms is
it's not,
plural, so symptoms are.
okay. The symptoms are not
Mhm.
specific
Mhm.
because they always didn't have, or how do you say, like,
No siempre están.
no siempre tienen como
Okay.
symptoms.
They don't. When you say they, you mean the patients, right? So you say they
Yeah,
don't. Okay.
sí,
They don't
yes.
always have symptoms or symptoms, or you can also say the symptoms are not there sometimes. Are
Okay.
not always present.
Okay. The symptoms are not specific, or they don't always have symptoms
Mhm.
because the hypertension is considered like
Okay.
generic,
Generic. Mhm. Okay.
or like if you have like a, how do you say, like mala calidad de vida.
A bad life quality or a bad way, a bad living or
But
bad habits also.
yes, bad habits. It's better because it's the habits like the food, like the sports. How do you say sedentary?
Sedentarism.
Sedentaries. Sedentaries. Okay, sedentaries and all that habits, like it's a complete like how do you say camino,
Path or way.
path path or way to the hypertension,
Okay.
and and uh, and the consults to the doctor is very important because of that, because they always the symptoms are not always present, and when you have the consult to the doctor, they with the tensiometer, like how do you say, cómo se dan cuenta de eso,
They realize.
they realize
Mhm.
that you can present hypertension and you need a treatment. But the hypertension have a little thing that is called, I don't know that if the traduction is good, but it's like a ay, no supe traducirlo. It's like, how do you say, como bata blanca, bata white
Bata, like the bata that the doctors use is a lab coat.
lab coat. And how, and pues no tengo que decir bata blanca.
Yeah, if you want, white lab coat. Mhm.
Okay. And one part of the hypertension is the white light coat, that means that the patient, when consults to the doctor,
Mhm.
are like very anxious and nervous, and
Mhm.
the high blood and the pressure, it's like above,
Mm.
like yes, how do you say,
It
Small.
rises, it goes up.
Okay, it's go up. It
Okay, but
rises.
it's like a psychological effect, more or less. You know, you go to the doctor and you get a little nervous, so that's maybe why your pressure goes up.
Yes, and we have to like suspect that thing because you know you was nervous and you if you was a doctor and you sent a treatment to the person that didn't have that treatment,
Okay.
it's very important that part. And for that part, we have to repeat the test of the tensiometer
Mhm.
and talk and relax the patient.
Okay, but I want to ask you, in the same consultation, you do that. An example, you go and the first measurement is high, so you start to think, okay, maybe it's a white lab coat and I have to take the
Yes,
pressure in about a couple
because
of minutes or.
because you know when you have that the consult when you like have an interview with the patient,
Mhm.
we like imagine what have the patient, you
Mhm.
know, and they and you know, then we ask like what is your habits, what you do,
Mhm.
all that things that that like complete and we think about a different disease and we always how do you say antecedentes
Yeah, background or.
backgrounds, yes. We always ask backgrounds of about her their families, yes,
Mhm.
it's their
Yeah,
families. Oh,
yeah.
okay, about their families because when you say like you are my patient and you say my mom have hypertension, my dad have hypertension, my uncle have hypertension, and we think like okay, Juan David, the possibility is that they have hypertension and no matter the habits or it's very helpful but it's the family also have hypertension, the possibility raise.
Okay, that's what I was going to ask you. Is hypertension considered to be hereditary?
Yes.
Mhm.
Mm, the how do we say
Hereditary.
hereditary? Hereditary.
Hereditary.
Hereditary. Hereditary is very difficult in medicine because it's not like hereditary directly
Mhm.
because you hereditary like the habits of your family because
Oh,
you
okay.
always like live with your family and like hereditary a lot of things that is not only genetic
Okay.
but yes it have yes environment things but have like a part hereditary and okay and we ask a lot of things and when you pass the part of the interview and go to the how do you say examen clinic examen physical
Physical? The physical exam or just the physical?
okay physical exam when you pass and go to the physical exam and you have like an idea that the patient have because they because the physical exam confirm that you
Mhm.
the things that you think
Okay.
because it's very difficult if you don't have like one idea that the patient have, or when it's a control exam, is the same. Like the doctors think it's a health patient, don't have backgrounds or hereditary things and good habits, that things. And when you like use the tensiometer, you know and confirm if they have hypertension or high blood pressure, because if the white lab coast is we can't call hypertension, it's high blood pressure, because hypertension is a diagnosis. Yes.
Okay.
And the other thing that we can use when we are in the consult, if you have like the severe pressure, you diagnosticas. Diagnose. You diagnose immediately. Yes, immediately. But when you have a 140 and or 130, you suspect, because it's white lab cause or hypertension, we don't know, and we send a exam. It's MAPA. I don't know. I think it's the same for the world in use. In English. Sorry, because that is is a monetary like all the day, when you go to sleep, when you go out, when you work, whatever thing that the patient do in the they I don't know how do you say como que haga.
Yeah, that they do.
That they do in all the day in their life.
Okay, and that is how is that map? Is like a monitor, or
it's like a it's like a monitor, but it's like a minus like a small cell phone, but it's not a cell phone. It's like a, how do you say aparato? I don't know.
You can say aparato. The word aparato is apparatus. Apparatus. Or you can say apparatus, machine, monitor, however you want to say.
It's like a machine, but little machine, and they have like a cables. Cables is cables.
Okay, the pronunciation is a little different. Cables or wires.
Cables. Okay, sorry.
Oh.
Thank you. Cables or what? Cables. They have a cable, and they put like in the chest. This is chest, yes.
Yeah,
in the chest, and they like monitor your sleep. And in the other thing is a very different maps, and other maps is in there and have like a little machine in your arm, and not have cables.
Okay.
It's a lot of machines. It's a lot of technologies, but I don't know about them, because I don't like, how do you say, or como que into that topic in a specific life.
Yeah.
Yes, because that is for another specialist. Okay, and that's it. When you suspect like hypertension, you can feel like a lot of mareos. How do you say mareos?
Mareos is dizziness.
Dizziness, or like tired, but is not, are not always present and are not specific of that disease. It's like It's like suspect and yes, that things.
Okay. So the general like signs, not symptoms, are maybe dizziness and fatigue. That could be maybe a
Yes,
clue
signs.
that
Yes, not symptoms in a signs. See signals. Yes,
okay.
sign.
Excellent.
Dizziness. And fatigue. Yes.
Okay, so I want to ask you some questions about this. Excellent job, to the moment, very clear explanation. And I want to know, what is a normal blood pressure? Just a normal blood pressure, what would be the measurement? Like 120 over something, or what is considered to
What?
be like
120
Mhm.
over 90
Okay, perfect.
is the normal.
Mhm.
But the woman have a low pressures and
Oh,
it's
really?
normal.
Mm,
Yes.
wow, I didn't know that.
It's because it's like the things of hormonal or whatever thing that
Mhm.
when you have a woman and have low pressure is normal, but in the men is
Mhm. Wow,
suspicious.
suspicious. Very good. Okay, excellent. And is it? I think is it one of the most common diseases in our country? Is it very like more or less? Is it like one of the diseases that most doctors see, or is hypertension? Something that is very present in our country because sometimes we eat a lot of fatty foods like empanadas and things like that,
Yeah.
or is it just like a problem, like you said in the beginning, that the whole world is actually, very prevalent or present hypertension?
Okay, is present in all the world because in USA they eat a lot of like process. How do you say comida procesada or junk food?
Junk
Yes,
food is
junk
comida
food.
chatarra, or you can say also processed
Yes,
food.
is and have different habits. Is in all the
Mhm,
world
mhm,
because when you ask or when you consult in the internet the first eh, how do you say como como la primera muerte en el mundo, la primera causa de muerte.
the first cause of death.
Okay, the first cause of death
Mhm.
is the eh, how do you say enfermedades cardiovasculares.
Heart disease or cardiovascular diseases.
Okay, heart disease, yes, or cardiovascular disease is
Mhm.
the first cause of death in the world. And when you know that, hypertension is very common.
Okay, so hypertension can lead to heart problems, obviously because
Yes,
it's directly, related to that. Okay,
yes,
and what are the if I have a high blood pressure, what are the maybe? Oh no, I'm gonna ask you something else. Is stress can stress contribute to high blood pressure? If I'm feeling very stressed or I have a lot of problems, is that maybe something that can contribute to me having high blood pressure or?
yes. My teachers say that the stress the is the is the worst thing that they can have because is they cause everything. You you can you can with the stress like develop a different disease
Mhm.
because when you have stress you don't like express and you didn't like do different activities and you are like how do you say like como consumido, I don't know, like yes,
Mhm. Consumidos, you can say consumed or, uh, You are consumed
Yes, the
or
things. And I
caught
think
up
that
with. Mhm.
this stress can when we have stress can develop a different disease
Mm.
and all the disease that we can have.
Okay, perfect. So what are some of the, or what is the normal, if I am diagnosed with a high blood pressure, what is the normal treatment? Do I have to take maybe pills? What is like what is the treatment of that type of illness?
Okay, we have a difference like niveles,
Levels?
levels. Yes, levels. Sorry, I don't remember
Mhm,
levels for the treatments,
mhm,
and we always no, sorry, and it's different if you are young
mhm.
or where you are old. It's
Okay.
different. Okay, and in all the treatments, we always recommend to change the habits
Mhm,
and to do sports, to
mhm.
change the food that they they eat. Yes, and but the most important is sports because
Mhm.
it's very related when the patient is it's a
Se- Sedentary. Sedentary would be
sedentary
sedentary. Mhm,
sedentary, yes, sedentary.
mhm,
And then if your pressure are not so low, so high,
mhm.
you always you only have changed the habits.
Okay.
But when the pressure is very raised, you have change the habits and another like a pill.
Mhm.
It's how do you say in English antihypertensivos.
Anti-hypertension, I guess.
Anti-hypertension. Okay, anti-hypertension. Yes, and we sent that,
Okay.
but it's very different
Mhm.
because if you have hypertension and heart fail, it's another complete how do you say como complication.
Complications.
Okay, complications that that is like change the treatment of the as yes change the treatment. It's you you know always in medicine we have general things, but always the treatment and the recommendation is focused in the patient because
Mhm.
all the patients is not always
Yeah, of
the same,
course.
and it have different things.
Mm.
And when I send you a treatment is not good for me, but it's good
Mhm.
for you.
Yeah.
For that thing, we cannot like how do you say como autodiagnosticarse o automedicarse, that
Self-medicate.
two things. Okay, self-medicate because when I think that Instagram is very dangerous about
Really?
that because all the people think that that the treatment that you have can help me and always self-medicate, and that it's a problem in the world because all the people self-medicate so much, and
Mhm.
when they need it in the moment when they have emergency, the pills didn't work
Mm.
because they self-medicate and show the like a lot of things.
Mhm.
pills in the work in the body and that things. That problem it's only in when you have like a infections disease, or how do you say, como enfermedades infecciosas,
Mhm.
infection disease,
Infectious diseases.
infections, así,
Infectious diseases.
infectious diseases, yes, infection diseases, because if you have, how do you say, bacteria,
Bacteria.
if you
the
have
same.
a bacteria, and you self-medicate
Mhm.
the bacteria because you didn't know that that bacteria, how bacteria, you didn't know the how do you say la composición?
Composition.
Okay, composition of that bacteria,
Mhm.
or her name or her family, because
Mhm.
bacteria it's like a animal, like
Yeah, it's a living
for
being. Mhm.
yes. And when you self-medicate,
Okay, give me 1 second, please. I'm sorry. Gonna say goodbye to my wife.
no
Okay.
problem. Yeah, yes, no problem.
Okay. Sorry about that. Okay. So when you self-medicate,
When you self-medicate, because you didn't the composition of the bacteria of live being, you can expose
estar expuesto a o exponer.
no exponer,
Expose, yeah.
expose the body, a pill that they can work because it's not specific for that bacteria. And when you have the other bacteria that pills can work, they didn't work because you after you, how do you say, como you expose in the pues como antes, pues como
Before.
que
Okay.
before, yeah, before, because you before expose. Yes, it's very interesting thing, and in medicine we have a lot of problems because of self-medicate. We like the teachers always says, please, like how to say enseñar,
Teach.
teach, please teach your patients that we never self-medicate, and that things because of infection disease is very important.
Okay. And I want to ask you, those antihypertensives or that medication, does it have to be prescribed or can I just buy it in a normal pharmacy? An example, if I had high blood pressure and I go to the pharmacy, give me a medicine for hypertension. There's normal medicine that I can buy, or does it have to be prescribed by a doctor?
In Colombia, if we are legals, is we have to prescribe.
Mhm.
But in Colombia, we can you can go to a pharmacy and they send they yes sell to you whatever you want. Is very big problem because in in USA is not that, is not the same. They have a very restriction things, and it's always you have to go to a prescribe thing and they send to you. But in Colombia we have that problems in yes, the prescription. But in Colombia, yes, you buy whatever you want in the pharmacy.
Very complicated.
Yes, is that a big problem and is related to self-medicate, because they say they sell to you whatever you want.
Mhm. Okay, excellent. And what do you think is going to happen with, these type of heart diseases and, things related to pressure? Do you think that it's going to get worse or it's going to get better? Because, maybe society is changing a little bit and we are supposedly, eating healthier, organic, things like that. But do you think that these diseases or, heart disease, is it going to continue to be the main cause of death? Do you think that there's going to be one way or one day in the future, maybe 20, 50, 100 years from now, when it's going to be different? Or, when you talk about that in the university, what do the teachers or you guys say? Is it going to be continuing to have like one of the biggest problems in health, or is heart disease going to come down? What's going to happen?
Okay, the biggest problem in health is that we don't have a like education
Mhm.
in all the world, because we how do you say, like, nuestro país,
Our country.
our, yes,
Mhm.
our country have a lot of problem in that things, but it's not our country only. It's not only
Mhm.
our country. It's
Mhm.
all countries around the world, and they didn't have like a like yes, like topics when you are in the school for a health living, or for health class, and that is a big problem, because then what people teach that, and if you didn't study medicine or things that related with uh, with the health of the yes, things like uh, like careers that can related with health, with life, and that is a big problem. And always the teachers say, like, we can, how do you say, como disminuir,
Lower or diminish.
we can lower all the disease, no only a cause of like a cardiovascular disease, and all the disease, but we have to start to teach the people, to teach and to prevent events, to teach that if in Colombia, in a towns, you see the people in a motorcycle with all her or with all the family in the motorcycle, without like protection, like, how do you say, casco, helmet,
Helmet.
without helmet, and we think, and that's a problem, because they can crash in whatever in in the street. I don't know, but the big problem around the world is that the people didn't know about things that when I start medicine, that things are very simple, but people didn't know. One day I didn't, how do you say, como nunca se me olvidó.
I will never forget, or I never forgot.
I never forgot never forgot a patient. I was very young in the career, and you know they have like a lot of how do you say pecas or
Freckles.
manchas.
Pecas are freckles and manchas are
Freckles.
spots.
Okay, freckles and
Spots.
freckles and spots, and I say to him like oh, I don't know, I don't remember the name, but for example, Jose, please use up like a solar, how do you say, like a protector solar, sunscreen, yes, sorry, sunscreen, use sunscreen, and they he said to me like, sorry doctor, I didn't know what is sunscreen, and like I am, because we are like kind of bubble, and you know, and you think that things like have a cell phone is normal, or have a computer is normal, have a TV is normal, and when you are related with that persons that are human and it's normal, that person don't have any problems. The problem that they didn't have, that they don't have the possibilities that we have. And that's a problem because they didn't know a specific things that are very important, and that people is like, is the, how do you say, the el agricultor, like the
The farmers.
the farmer, yes, the farmer. And sunscreen is very important, or teach that when wait, if you don't have like money for sunscreen, you can use like a hat, like a protect a shirt with a long yes, how do you say, like
Long sleeve.
long sleeve, yes, and that is very sad, and is very like, it's like a crash in your life, because you understand that we live in a world, because it's not only in Colombia, in Africa, in another things, and in USA, the people didn't know that topic, things that that things that are very simple, and we think like we have a, how do you say, deficit.
Yeah, exactly. Deficit, the same word.
We have a deficit in concepts that are very easy things, I don't know, and for me that things are very sad, like crashing in my career, because you want to give to Jose a sunscreen, but you can't, because you have a lot of Jose's that they didn't know that
you cannot take it personal,
sunscreen,
because you try to treat every patient, and
that thing is very difficult, and the thing that and the problem that I think that is we have a lot of people that don't have the opportunity to study, or they didn't, because they have the opportunity and they didn't want to.
okay.
It's the other thing too,
Mhm.
and that is very sad. And to like to summary of all this topic, I think that the problem is that the, how do you say, como, how do you say, like como si, how, como el desconocimiento, pues,
The lack
no,
of
the
knowledge.
problem is that education.
Okay.
Okay, the education that
Mm.
the people don't have education and that.
Yeah, that's true. And I think also, thinking about it personally, one thing is that, an example, my case, I only go to the doctor when necessary. And, that's something that is also a problem. And I recognize it because, you should have normally, like a checkup or a consultation with a doctor, at least, like once a year or every 6 months
Yes.
or whatever. And that's not my case. It's not my case because I only do it when I'm sick. And, thank God or thankfully, I don't get sick as much. I have a common cold or something, but I never get something very strong. Only when I feel something strong, I go to the doctor. Or an example, when I change jobs, you have to have a physical exam.
Yes.
That's the only way. That's the only time when I go to the doctor. And I remember one consultation that I have when I was changing jobs, and I was working in another company. And I remember in that checkup, in that consultation with the doctor, she told me, you are overweight. I said, no, I know I'm a little fat, I have I
Ah,
have extra kilos and everything. She said, no, you are not fat, you are overweight. And when she said that word, I was like, my God, I didn't, or I didn't suspect that, because yes, I'm fat, but whatever. But when she said that word overweight, she says you have to be very careful because the step or the level from overweight to obesity is not very big. And there's one, and obesity obviously brings a lot of problems. And
diabetes,
I was 12,
hypertension.
yeah, hypertension and everything. And I was 12 kilograms overweight. And when I said, I was like,
Yeah.
oh my God. And when she told me that, and that actually helped me because I changed a little bit my habits. I didn't make a 100% transformation, but I did start eating a little healthier and I was able to reduce most of the weight. But I think, that's a problem because sometimes, we only go to the doctor when we have to. We don't have the habits in our normal lives to have regular physical examinations, just every year or every 6 months. Hey, let's go to the doctor just to check how I am, because sometimes we are working and very busy and we say, no, I don't want to ask for permission to my job just to go to the doctor. Or no, the doctor's appointments are, there are a lot of people and I don't want to go. So I think it's also like something cultural that I don't have like the culture to, go and have a physical checkup regularly.
Yes, that thing is very common in all the people because, for example, Martin, they hate doctors, and I say like I am like studying to be a doctor, and you have to trust them, and you have to consult because Martin hates that, and I always like go to the doctor to a check, to regular check, to go to the like a specific things, and he always say no, 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 and that it's a problem that it's the problem that I said before, because the people they didn't know that things are important to
Mhm.
to go to the doctor and control things, and you didn't know that you are overweight, and if you didn't change your work, you didn't know that thing, and you go to obesity and have a lot of health problems like hypertension, diabetes, and a lot of like how do you say cholesterol,
Cholesterol. Mhm.
cholesterol, high cholesterol, and like how do you como, ¿cómo se dice? Yes, like in in medicine, all that things that it's related with the hate, with the yes, to the with the hate is peso, cierto?
Weight.
Weight.
Mhm.
weight. The weight, like when is raised, it's the name is síndrome metabólico.
Okay. Metabolic syndrome. Mhm.
Metabolic syndrome. Okay.
Right.
Metabolic syndrome, and in that syndrome are it's diabetes,
Mhm.
high cholesterol, and all that things.
Okay. They are all like related or connected.
Yes, but when you like the doctors say to you like you have a metabolic syndrome, you can have or one of that disease or all the disease,
Okay.
or two of the disease. Yes,
Okay. Very.
a big name to represent all the disease. It's like a metabolic is the name of the group. Yes.
Mhm. Yeah, because it has to do maybe with the metabolism of our bodies and everything that has to do with the process of what is. Mhm.
But how do you say the conclusion? The conclusion. But the conclusion is that you didn't know that that is important.
Mhm.
And when I say before, the the conocimiento of that, how do you say like
Knowledge,
conocimiento?
conocimiento,
The
knowledge.
knowledge
Mhm.
the people didn't know.
Of course. Yeah. That's something, and that is your job in the future, obviously in your consultations to teach people as
Yes.
much as possible. Yeah, because like you say, sometimes we only learn things from our doctors. There's many things, and obviously I think that's one of the most important works or one of the most important jobs that a doctor can do, not only just give the specific treatment, but actually try to change people's lives and try to change their habits, because people obviously respect doctors. And your parents or your wife can give you the same recommendation. An example, my wife and my mother, hey, don't eat so much junk food. And it's like, no, nothing is going to happen. But then when a doctor says it, okay, maybe I think it's a little more, more respect for the tradition, and just that they're worried about you.
Yes, and you know that 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 thing to the doctor is very difficult, because when, for example, we have a consult with old people that people have like they live her life or their
Mhm.
life, and they like they don't have like, I don't know how do you say como no les importa,
Yeah,
or
they don't care. It
it's
doesn't.
very
Yeah.
yes, they don't care, because they say like, oh, I live all
Mhm.
my life with that, and I didn't have anything. And for that people, for that like group of people is very difficult,
Mhm.
because they have like, tercos.
Yes, they are very stubborn.
Yes, they are very stubborn, and it's very difficult. But when you say the example for your family, we always, I don't know how the people, the person, it's always think that when the people in the street say to you it's true, but when the family say you didn't care and you didn't listen, and no, 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 but when the people in the street say to you, oh my god, yes, I don't know. And that is like a problem, because when you say in your house like Jose say to me that, and your wife like, I say to you that you didn't listen. And I think that think is very common
Yeah, it
in
is.
all the people.
Yeah, of course. Like you say, many sometimes we're stubborn, or we are very, also another word that we can use, we're very proud, orgullosos. Sometimes we're very proud because we say, no, we don't have problems, nothing is happening. And then when somebody else says it, obviously it's more our pride, or we are very proud and talk about that. So I think that's something that, like you said, obviously we have to do a lot of more education, and obviously everybody
Mm,
has to be involved, the government and everything, because you don't see a lot of commercials or things about taking care of your health. Obviously there's campaigns that many people do, like the INDER with the ciclovías and doing exercise and things like that. But I think there's a lot more that people can do, more programs that we can see, more education that can be done in school, in the universities, because health is something extremely important, but we don't take it as important as it should. Our health is only important when we are sick. When we are healthy, we say no, everything is good, nothing is happening. But we have to do, like you say, preventive things. Obviously I think people say
prevention.
that it's better to prevent than lament, because obviously if we try to react, reactions is going to be a lot more difficult than trying to prevent it. And obviously if we don't have the campaigns, if we don't have maybe the compromise or the commitment of everybody to educate ourselves in how to be healthier, maybe the problem is going to continue longer than it should.
Yes, yes, that is true, and that is the problem of the world, because for me the future is the programs that the people that the teachers repeat and repeat all the time to us, like PMP. I don't know, like in English is like the traduction is the same, but is PMP, in Spanish is PIP, promoción y prevención,
Mm-hmm. Will be
like
similar. Yeah.
promotion and prevention.
Yeah.
Yes,
Mm-hmm.
and that thing, all the teachers are work for that, or all the doctors, because that thing is the future to change and to save of the people that if you when you, I don't know, you are like understand the things that I say to you, but I don't know if you know, and or you didn't know, but you learn some things that you didn't know, and you think like, okay, if I read, how do you say, como reducir,
Reduce.
reduce junk food, I can prevent a lot of things. Or if I like start to do any sports, like walk, whatever you think, but not to stay sedentary, I can reduce a lot of disease too. But and I think that is the future to like to share to the people that think. But do you say that and I am with you when you say like the promotion, or the things of a Linder, or on any activities, the people they didn't know, and because the government is not like a share a lot with the people, and the people too don't search that too. And I think that have a problem to in the government and to the people, because they like, we are not connect, and I think that thing is another problem.
Mhm.
And we can do another like campaigns to show that in that things like have a lot of things because are because you know that have another like how do you say compañías company how do you say compañías pues como
Companies.
companies that have like companies that are very like poderosas, how do you say
Powerful.
powerful, that have a lot of money and didn't like a have interest about the
Mhm.
things, and that thing is a problem because that companies are very big in the world and our the countries, and didn't like help to the doctors to that, because the doctors we are very like small in we are a community that are very small to express to the people that things. And I think if the companies that are very powerful and other things, we help, we can like in the future help
Mhm.
to us in that thing. But yes, I think that was a very problem. I don't know. I think like I talk too much because I have a lot of ideas that I think, and I want to say to you, and I don't know if correct when I say it. I don't know.
Yes, you're doing a great job. I correct you when I have to correct you. You just keep speaking, speaking, speaking. And there's something I have to correct, but your ideas are very well expressed, and just relax. Remember, just talk, and whenever I have to correct you, I'll do it. But if I don't correct you in a long time, it's because you're speaking very well and you're doing an excellent job. Okay.
Okay, and yes, I think that I always think that we all the people like think that how we can change the world,
Mhm.
and that is impossible, but we can like with baby steps
Yeah.
to to control to help that thing, but I think it's very difficult.
Yeah, of course, that's something that obviously, that one of the things, or my opinion is that one of the most difficult things for you is to deal with people. An example, when you deal with, in my case, I work with logistics, I work with people, I work with trucks, obviously, okay, there's a problem, but when you are working with people and specifically talking about health, is something very complicated
Mhm.
because of many factors. People are stubborn, people are proud, or like you say, some people don't have the knowledge, and it's not necessarily that they're stubborn, it's because they don't know. They, like the example that you told me about the person that had the freckles and the spots, and like you say, we take many things, we take things for granted. And take things for granted is tomamos las cosas por sentado, damos por sentado. We take many things for granted, and
We take
something
or we make.
we we take, sorry, thank you, we take things for granted. We take things for granted, and we think that obviously we have access to a lot of things and other people don't. The simple thing of, like you said, the example of sunscreen. When you were telling me that, I was like, incredible, everybody should know what sunscreen is. But not necessarily a person that is living in a town or in a mountain or very far away, that and sometimes sunscreen obviously is healthy, but some people think of it more as a cosmetic thing than others. So obviously, or like men say, oh no, I don't need sunscreen, sunscreen is for
Yeah.
women, I don't need that, no, I have skill. Or people that have darker skin, that are black or something like that, or that have very dark skin, no, I don't need it because look at my skin is dark, so I don't need it. But it's the same thing. I think skin cancer and things like that, diseases, can can affect any type of person, and it's not necessarily the color of your skin or if you are rich or you are poor. It's the thing that you need to use it because the sun is strong. The sun has radiation, and you have to know that. But sometimes we say, no, I don't need it, and because or it's not necessary, or I need it because I'm very white. So, if I don't put on sunscreen and I'm going to get very red when I go out, so that's why I use sunscreen. So, that's something very important that you are saying, that, and very difficult, I think, for you guys, because you have to try to educate the patients that you see, and obviously the patients are a case by case, and the patients have many different histories. Patients are rich patients, poor patients, middle class patients, and some people have problems with their wives, some people have addiction problems, some people have low self-esteem, low self-esteem. So obviously you have to be a combination of everything. You have to be a psychologist, an educator, and a doctor. So, I think that's something very important that you guys do. But I say also it's extremely difficult. The work of educating people to be healthy, I think it's something that is very complicated.
Yes, yes. If when my career advance, yes, and advance my career advance, I think that that problem is more difficult when how do you say como avance en la carrera?
When a career advances.
Okay, what my career advances, I think that
Mhm.
that problem is always more difficult, but we learn about it, and we always have have the thing that we can always help the people, but you know that the doctors teach to us that we always the doctor have to like stop in a part, because you always can help all the people and all the things that the people have, because you have to like focus more in medicine, but but obvious you have to listen, because when the patients talk, they like relax and talk with the doctors, and they always like admire us. Yes,
Admire.
admire okay, admire us, and that thing is very important, because when we say to them one thing, because they admire us, they like listen to us.
Mm.
And but but the doctors always says that we can help only in a part of their life, because we can change the problem of the money, or that things we can, like, yes, to talk, to recommend that. But that is sad, because we want to help with all the problems that the people have, to, or if you have to money problems, I can like search to a work to you, but that is very difficult, and is very sad, like sad. Yes, because we can help in all the things, and we can like help in only like in the health of the people. And but but I don't know. We always like uh, like search for the good of the patient,
Mm.
and it's very difficult. And they we and the health and the mental health for the doctors, I think that is very important, because when you realize that you can help for many things, you are like sad, because it's like, how do you say, como impotente?
Yeah, powerless or impotent.
Yes, come powerless for that things, and that like affect our life, because I am a student,
Mhm.
and I listen a lot of problems that I can't believe, like it's very impression. I don't know when the doctors have like how many years and passed for that problems, and listen always that things is very like impressive,
Impressive.
impressive. Yes, impressive, and is very powerless to all the doctors. I think for that, I don't know if you notice, like the doctors are very, not all the times, but the doctors are very like focused,
Mm.
like serious,
Yeah.
and they don't express, because for 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 many doctors are very difficult that part.
Mhm.
But I learn, and when I consult a doctor, and I like, I feel that impression that the doctor have like is serious, and that things, I think that the doctor, when is that, is not like connect with the people, and it's very
Mhm.
bad, because you don't have like the, how do you say, confianza,
Trust.
to the trust, and that things, it's not help for the patients, because no express, uh, and no say all the things that they have,
Mhm.
and I think that is another problem.
And in the university, what do they say to you? You know, when you are having like a consultation, do they say, an example, if I want to be like a very happy, positive person, do they say you should be that? Or they say that you should be like very, serious? Or how should, is like the recommendation to talk to patients?
Okay, and I can I say another thing, when you say before, um we can like help the people a lot, because the time of the consult is very
Mhm.
short,
Yeah.
and that thing is like that like one thing that the teachers always repeat to us, and say like, you have to help, you have to listen always the patient, and don't interrupt, but that are limits, and you have to control that, because you don't have time, and when you pass the time, your worker, yeah, like your, how do you say, like your jefe,
Your boss?
your boss, yes, your boss, like paying attention to you, and because we like have a lot of patients to see in the day, and that thing is like teachers always say to us, and always, no, this the university say that you have to smile, to treat to like have a little space, the trash with the patient, because it's very important for the patient have the connection and the trust that the doctors bring to them, because they can express all the things you know, when they talk to us to another problem and say like, oh, I know I okay, I am like a patient and you're the doctor and say, Dr. Juan David, yes, Dr. Juan David, I know. I am in the consult because I want to you know to I how do you come like yes to a control, but I am fine, I don't have any problems, and you know, okay, I send to us, and you never like yes, a routine checkup, and you never like do a physical exam, and then and she didn't say to you anything, and okay, you go to your home, okay, and do that these exams to yes, this exam that in the laboratory, yes. But when you have like the space to talk and and I say to you like, you know, my husband treat me bad, and they like is violent, and you know, like I have to check up, and I have to do, I don't know, physical exam to search a lot of things, and that trash give to us like a very like a specific things that we can use for the disease or for the problem that the patient has, and always and pues to control to respond to you, uh, the things you say to me, to us, to me, that yes, the university always like learn and I know teach to us and say to us like always play, always be happy, be smile, always like to remember that we always have to be a good person, that what person that person how do you say como puede ser,
Can be.
can be your family friend, and whatever that thing, and yes, and always like teach to us like a like like yes, como how do you say como valores,
Values.
values,
Mm.
yes, teach us values. I'm reminded because people like forget the values,
Yes, that's
and
true.
there for example, when you are in a consult, when hi doctor, and the doctor said to us, please give me your name, and didn't say hi, and that things are very important.
Yes, extremely important. Very good. Okay. Excellent job so far, Sophia. So next, you were wanted to talk about a snake bite, right? Was the other.
Okay, but with the snake bite, I didn't know a lot of words in English.
Okay, let's practice. Let's learn together because, you know, obviously sometimes I'm going to learn words with you. So go ahead and we'll learn together.
Okay, in the snake bites, we the name of the accident or in Colombia is it's the name is accidente ofídico.
Ofílico. Okay.
Ofídico.
Ofídico. Okay, give me a second.
Ofídico. Accidente ofídico. That I don't know that. Yes, accidente ofídico.
Ophidian. Give me 1 second. Let me just reconfirm. I think it's supposedly in the translator, it says Ophidian, but let me see. Ophidian.
Snake bite.
Let's check. Yep. Ophidian accident.
Okay. Ophidian accident. And the Ophidian accident, they have a different family of well, we start with to like a different the snake, like how do you say vibora,
Viper.
viper, and serpiente.
Snake. Normal snake.
Okay, is the snake. Okay, it's the
You
same.
can say snake
Okay.
or serpent is another name for serpiente.
Yes, snake and serpent is always the same, but the name of vibora, the viper, is when they are venenoso. Como how do you say
Okay. When they are venomous.
venomous?
Mhm.
Venomous.
Venom.
Venomous. 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 I pronounce
Yeah, venomous.
venomous. Okay, venomous. Okay, and this viper is when the snake is venomous. And we have different families of vipers. When when I say vipers, you know that are venomous. Okay, and we are at different vipers. I don't know. I say to you that I didn't know the words.
Right.
The
Right.
words, but one of the family is Botropico.
Mhm.
No, Botrops. Botrops. I don't know. Is the same of. Is the same in
Let me see. Oops. Let me look for it
Botrops
because
with H in the Bothrops. Yes.
okay. Nombre como yep. Bothrops. Got it.
Yes, it's the same. Okay.
Mhm.
Botrops then are Lachesis, Lachhesis.
Okay. What is
Lach-
Lachesis. Okay, yeah. Let's see. Yep. Supposedly it's the same in English too. Lachesis.
Okay, and the other ones
Mhm.
are corales.
Coral. That one I know.
Yes, coral and the crotalus.
Ugh.
Crotalus.
Again. CR. Begin again, please. CR. Mhm.
Crotalus. Crotalus.
Let me check. Dun. Those are supposedly like I'm seeing rattlesnakes. That's the thing. I think it is because it says here in Google it says cascabel. So if we're the
Yes,
cascabel
cascabel. Yes.
would be those. I know that one is called a rattlesnake.
Okay.
Mm.
The rattlesnake. Okay. And we have that, like in vipers, we have that family. There
Mm.
are venues.
Okay.
But we have another family that are not venues,
Mhm.
that the name is, no, colubri, but it's Colubridae.
Colubri. Okay. Colubri. Mhm. Okay. Check here. colubrid.
Colubrid. Okay, colubrid. And that family is not Venus. Okay. And okay, snake bite is very important in Colombia because we have a lot of like towns. We like have, how do you say, como selva or
Jungle.
jungle? Yes,
Mhm.
jungle and a lot of family or a lot of, yes, different animals that are very like strange to us.
Mhm.
And but you know, in Envigado, I live in Envigado. In Envigado are a lot of snakes.
Really?
Because have a lot of like mountains and like how do you say, like como ríos.
Mhm.
Or
Rivers,
like it's not rivers, it's como
como streams, como like charcos. No, it's like small rivers. Yeah,
yes, yes.
I'm forgetting the word in Spanish.
Yes, I didn't remember the word in Spanish too. Like, okay, rivers. Yes, small rivers.
Yeah, or I don't know the word in Spanish, but I know the word in English. For little rivers are called streams.
Okay, it's streams. Okay, and it's because in Envigado I a lot of streams.
Mhm.
And okay, the most common family viper in Colombia is the botrops,
Mhm.
and as very common and then the the lachesis,
Mhm.
then the crotolus and the coral are very like in that like in that
Order.
order. Yes, order. In that order are the importance of the snakes in of the vipers in Colombia.
Mhm.
The Ophian accident is very important because the venues of the vipers are very toxic,
Mhm.
are very venues, yes, are very toxic. And can you take, like, how do you say, como que te pueden, o sea, te pueden quitar la vida, like, can you like have the, I don't know,
They
can you
can
take
take
your
your
life?
life away, take your life
Okay,
away, or they can kill you. You know, the
yeah,
simple.
they can kill you. Okay,
Mhm.
they can kill you because the venoms are very toxic.
Mhm.
And we have to know about them because Colombia have a lot of have a big tropic in a big jungle. Okay, the Ophidian accident, it's represent about snake bite.
Mhm.
Yes, and when you have a snake bite, you can like how do you say,
Recog-
how
yes, reconocer, recognize.
recognize, yes, but I have to pronounce good, recognize, yes, to recognize what the family is, because
Mhm.
different family like botrop, lachesis, coral, and rate tree. How do you say rate snake?
Rattlesnake.
Rattle snake. Okay, rattle snake can give symptoms. Can you can give up to different signs and symptoms. Yes,
Okay. Mhm.
but the most like toxic are botrops and corals because they can go to the, how do you say, like nervio, como
Nervio alone is nerve. Sistema
nerve,
nervioso, nervous system.
sistema nervioso, yes,
Mhm. Nervous.
nervous system, and we can like yes, attack the old nervous systems and
Mhm.
can kill us.
Mhm.
Okay, it's very general, the
Oh,
okay. And you have to when you are in the jungle or in a town and you like feel is snake bite,
mhm,
you have to go immediately to a hospital, to whatever like center that have like medical staff, because that is a emergency.
mhm.
That thing, that the snake bite is a major emergency thing. It's very we have to be very fast
Mm,
about the
okay.
control of that
Yeah.
accident.
Mhm.
Because if we like how do you say, no esperamos que pase mucho tiempo, we have to spend a lot of time.
Wait for a long
Oh, wait,
time to pass. Mhm,
okay, wait for a long time to pass the snake bite. We the venoms
mhm,
go to the nervous system so quickly, and like the symptoms and signs, or signs and symptoms are like how do you say, como irreversibles,
irreversible.
irreversible, yes, irreversible. And you have to run when you have like ophidian accident. And always you have like only 3 or 2 hours to like the signs or symptoms like present in the body, like how do you say, como yes, to que
Yeah.
empiecen to start the signs and symptoms, yes. And you for that thing you have to run, for that two things you have to run. and 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 always we like ask the patient if they recognize the viper, because I don't know if you like recognize, but all the people say like, that is a coral, or that is a like real snake. And because in Colombia it's like cumin, uh, you have to tell the doctor if you recognize the viper. Or always we recommend when we like teach to the community in the towns, that if a snake bite, that yes, that when you saw a snake or a serpent, you have to how do you say, como alejarse,
Get away.
get away of them. Or if you have a ophidian accident, that
Mhm,
is a snake bite, you have to take a picture, but
mhm,
to that help to us to recognize and give the specific treatment.
mhm.
And that is very important. We recommend that never like how do you say, como torniquete, do a
Never
tourniquet.
tie or make a tourniquet. Mhm,
Okay, never make a tourniquet,
mhm.
never, because you didn't the technique, and you can complete like can you how do you say,
Complicate. Complicate.
complicate, yes,
Mhm,
complicate like the snake bite. You only you only have to do like a clean up with water on that thing, only that thing, because the people didn't know that didn't know the techniques to say that thing, that. And always we have to teach that in the towns have a lot of like remedios caseros. How do you say?
Homemade remedies.
Yes, homemade remedies,
Mhm.
and or how do you say creencias,
Belief.
belief, and that are very difficult because for the people that believe in homemade remedies is like the control for the things, because that things always like it's in a towns, and
Mhm.
the people in a towns, we like before we talk yes, the education, they don't have that, and always we like when we talk with that people of patients, we always try to teach that things, and say that the only thing that you can say is run to a hospital.
Oh my God.
Yes, because he saved the life,
Mhm.
because they make homemade remedies, believe, and they saw that things didn't work, and when the patient is very, how do you say,
Grave or serious or
grave of serious, yes, they run to the hospital, but it's very late, and that is very, like, yes, it's not save the life. Okay, and we recommended that when the people is in the farms, and
Mhm.
like it's like a working the things, we recommended always like put boats,
Mhm.
and like how do you say, like the shirts like have
Long
a
long
like
sleep.
long sleeve, yes,
Long
long sleeve, and on all that things of protections.
sleep.
Okay, when okay, and before I say to you that we only recommend to take a picture, because
Mhm.
it's very helps to us to recognize the snake, the pipe, and do the treatment, because for the different families we have different treatments,
Mhm.
because a different family is more venomous than other family,
More
and
venomous.
more venomous, yes,
Mhm.
and we use the, how do you say, we use the treatment is like a, like, how do you say, suero?
Serum.
Okay, I don't know, it's the same in English, but it's suero antiofídico. It's like serum antiofídic, because you traduce accidentofídico. I
Mm,
know, I think that it's the same.
Okay. Let me look for antioxidant. Yeah, you can say antiophytic serum, or you can also say antivenom, which whenever one.
Antivenom, yes, antivenom. And we use antivenom, but we have like recognize the snake, the bite, but when the patient didn't have, they didn't saw the viper, and they didn't take a picture, they only have the snake bite, when we related like the symptoms and signs, and we suspect what family like bite them.
Okay, are the bites different? Is one way that you can identify is the bite may be different? An example,
Yeah,
bigger, smaller, like
yes,
triangular, or
yes, that is very, the animals I don't know, when I started that career, I know that the human body and the animals and like how the universe is perfect, because have things that we don't like think about it, and when we start to learn and to see that things, you, oh my god, it's very perfect, like all the nature and all that things. Okay, yes, they have different like bites. And for example, the coral, it's the bite is very marks. Okay, the bite marks of the coral is very small, because the coral have is very the coral is very small, and have the mouth is very small of, and they have like a different, how do you say, colmillos.
Thanks. Thanks is colmillos.
Fangs. How do you say?
Thanks.
Fangs. Okay, fangs. Yes, and they have a fang, different fangs, and for example, in the coral bikes mark are small, and the botrops bite marks are very big,
Mhm.
because the botrops are very big, and we can like yes, different about that.
Okay. And I wanted to ask you, just in case you're not able to identify, is there like a universal anti-venom that you can use, or it has to be a specific one? An example, can I use an anti-venom that is for a coral, for a bothrops, or the other way around, or does it have to be a very specific one that I use?
Antivenom is very specific, because no, it's very specific, but about the families.
Mm-hmm.
It's very specific to the corals, to the botrops, but for the botrop of the lachesis and the coral, no, and the, what is the cascabel is snake,
Rattlesnake.
rattlesnake is like common. The one of the different venoms is the coral, because the coral is very different, it's very small, and is like another different family, and is very toxic, and have like another. But you know, when you have like a snake bite, are very different antivenoms, that when you like put un antivenom and didn't work, and you, oh my god, I suspect that family, and I didn't know that family is, and it's a lot of, it's another treatment,
Mm-hmm.
that is the antivenom is not help. It's another treatment, but it's very specific. It's like
Mm-hmm. Okay.
it's not common to use
Okay.
the other treatment. But these antivenom are very important, and for the, and you know, the snake bite, I didn't know. For the trees, I didn't know that the snake bite is very common in towns, and in the towns that is not a hospital, but is like a, how do you say, como punto de atención.
Yeah, like an attention point, or like
Yeah, like an attention point, and they like have the antivenoms, because they are very common, and you didn't have to like transfers to Medellin, because it's very like yes, this have a very distance, the
Mhm.
town to Medellin,
Long
but
distance. Mhm.
how long the distance? Okay.
Okay. And do those antivenoms, do they have to be like refrigerated, or it depends like on the snake, or they're just normal, it doesn't have to have like a special care, they don't have to be like refrigerated like vaccines, that some vaccines have to go like in a cooler or a refrigerator. The
Okay.
antivenoms are
Okay, the antivenoms, no, it's now always refrigerate, and they always have to to put the antivenom with how do you say solution salina?
Saline solution.
Saline solution, yes, with
Mhm.
saline solution, like how do you say diluido?
Diluted.
With it's diluted with saline solution and antivenom, and once no, how do they como unos?
Some.
Some
Mhm.
antivenoms like it's in a like a polvo.
Powder.
It's okay. Yes. Some antivenoms. It's a powder that you with a little saline solution or another thing that the antivenoms comes. You dilute, and that is the antivenom, and that didn't have to refrigerate.
I didn't know that their antivenoms were powder, some of them. I thought that they were, like the little bottle that you got it in.
Yes. Yes, that's very like interesting thing.
Okay, and what are the common symptoms of the snake bites? Maybe do the people get red or do you know how to say hinchar?
No,
Hinchar is get bloated.
okay. Like the always that the when we suspect, we always suspect when you have like a bite in the how do you say pierna?
Leg?
Sorry, in the leg. Yes, in the leg. I think that I don't remember when I talked. I don't know why. And in the leg, and we saw, and in the bite is like in sometimes with a vipers, the bite like how do you say sangrar?
Bleeds.
Bleeds.
Mhm.
Yes, bleeds, and we like recognize bleeds and get blowed, like in the back, bleeds, get blowed, and how do you say como que también okay, no, bleeds and get blowed. In another
Okay.
times always get blowed and like se pone roja, how do you say como like, but no bleeds because
Gets
it's not
red.
okay. In sometimes when other bites families, in another's like vipers families, when they have the bite, the bite not bleeds but get red and get blowed, and we can like a different with that part because the coral don't bleed,
Mhm.
doesn't bleed. Okay. And other things that is very common and that they have like, yes, the like pain in the bite is
Mhm.
very common. And you have like, I don't know, it's a terms in Spanish como parestesia, es como que parestesia significa como que se te duerme el pie.
Okay, so you can get,
Es
you
como
can
si
say,
fuera un calambre, pero no es
Mhm.
pues no es un calambre, pero es como que si a uno se le duerme.
So maybe gets numb is like in Spanish say entumecer, very similar that you can say like that, or your foot gets numb, or your foot, or you can say you feel you feel like your foot goes to sleep.
Okay, I think that your foot gets numb. Your foot gets numb, and yes, like and foot gets to sleep because you feel like entumecido,
You feel numb.
numb. Yes, you feel numb. Okay. Okay. In another families, the bites can be like necrosis. How do you say necrosis? Like,
But it's like the skin dies, right? Or something like that. What is?
yes.
Okay. Mhm. Let me look for the technical word, but I know that necrosis is when something dies, like it.
Yes.
Let me look for the exact word. Yes. 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 Okay. Yeah, it's the same. Necrosis or premature death of cells. Yeah.
Okay, necrosis. And for example, botrops and lachesis, they can like have necrosis in the bite, but coral no give necrosis.
Mm.
It's very different. And okay, if we for the bite snake always we always have like levels like a low, moderate. Yes, moderate is, yeah, it's moderate
Correct.
and grave.
Mhm.
Okay, low, moderate and grave. Yes, and like life. I say life. Yes, life. Moderate and grave. When it's like a left,
Low or
low, yes, little low. It's when you feel like symptoms in the bite. Only,
Mhm.
only when you feel symptoms in the bite, and you don't have like another signs or symptoms in your body.
Mhm.
When the level is moderate, it's when they have like a headache, and have a lot of other symptoms that are like a headache, like how do you say, visión borrosa,
Blurry vision.
blurry vision,
Blurry. Let me write it. Here.
blurry, okay, blurry vision, and blurry vision, and have like a like how, I don't know, that are terms in Spanish like uh, when we refer to like facies in Spanish es como facies, o sea, como expresiones de la cara.
Okay. Facial
They say
expressions.
facies,
Mhm.
facial expressions in English that
Mhm.
are like we have like a facial expression of like neurotoxic,
Mhm.
neurotoxic fashion expression, and they have like a, like how do you say, como dolor muscular,
Muscular pain. Mhm.
muscular pain. They have, okay, a lot of things. And when it's grave is when you like you can't do anything, you have that like blurry vision in like in is very raised,
Mhm.
the facial expression is very rare, it's very, how do you say, rara,
Yeah.
like
Right.
right, yes, right, and like the grave is like the signs and symptoms moderate, but is
More
more grave.
serious. Uh-huh.
Yeah,
Yes.
more serious.
Mm.
And 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 that's it.
Okay, and
But
can some of them cause paralysis, or like the paralysis of
yes,
the
yes,
face and things like that, or?
yes,
Mhm,
yes, they cause paralysis.
mhm.
Yes, they cause paralysis, and but not only no all the families, because I say before
Mhm,
that only one families like can attack the nervous system,
mhm.
nervous, and they can like uh, uh, induce paralysis.
Okay.
To say inducir,
Yes, yes, induce.
induce paralysis, yes. And that's it. Is because I it's very general, because they have like a lot of
Yeah, I know
uh,
it's more specific technical terms, medical, and that obviously.
no, and have a lot of like signs and symptoms, but I don't know the name in English, and I don't, how do you say confiar,
Trust. Mhm.
trust in the traductor, because
Really?
because I don't know, is no, it's because English, but when you don't know like a lot of English, like you are you desconfías, you
Yeah,
are
you distrust. That's no problem. But I'm going to give you a little tip that I do when I have to look for a word.
yes,
There's many words in Spanish that I don't know. So what I always do is when I find a new word in English and Spanish that I try to translate, I try to put it in a sentence in Google. So an example, what I do is if I like the words that we've been searching, when I
yes.
find the word in English, I always put in Google, what is tan? And if it gives me a definition and it takes me to a dictionary or it takes me to Wikipedia, I know that it exists, or it gives me another variation of the word.
Okay,
So an
okay,
example, yeah, you're looking for a word. An example, give me a word, any medical word that you want to give me in Spanish.
okay. Mialgias.
Okay, so mialgia. So I'm gonna show you more or less. Let me change the screen and give me a second. All right. So you know,
I want to ask you
mhm,
something.
of course.
If you regret the like the class, como la veo? How I can see the
Oh,
class.
I am going to, I can send you I'm going to put them on the YouTube and I will send you the links to the videos. Of
Okay, thank you. Yes, because I want to repeat that
course.
for like the new terms that we learn.
No problem. So an example, this is what I do. First, I look for the word in the translator and bam. So supposedly this is the word in English. So what
It's
I
the
do,
same.
and then it has a little change in the spelling. So just to make sure that it is the same word or that the word is correct, I go to another page in Google and I put something like this. What is myalgia, right? And then it gives me
Yes,
like the definition. And that's how I know if the word is translated correctly.
yes, it's correctly.
So
Okay.
that's something that you can do. I understand, and that is something very common for many people when we're learning a new language. Translators are very complicated, and I understand you 100%, but we have to use them because it's necessary, but we don't have to trust them 100%. What can we always do? We can take them to the original language, or we can take them to English, and then we can look for that word. Because an example, if I look for this word like in Spanish, right? If I say, what is mialgia? Look, it's not going to appear, right?
Yes, but it's
Mm-hmm.
the correct the word.
Exactly. So that's what you can do. If you don't trust in a word, always try to put it in a situation or a context. An example, if it's a verb, if it's an adjective, if it's a noun, you can try to put it, look for that specifically, and that's going to help you just to make sure it's correct.
Okay, okay, yes,
Mhm.
yes, because when I was in the like the levels of the English in the university, always the teacher say like don't translate, but you need words, and we I don't know that when you didn't have like a dictionary, and
Yes.
that thing can help. But when you traduce all the sentence, they like put like like things, but I don't know, like
No, no, I understand you. It's just that one of the things that we have to know how to translate, because one of the most common things that we have to take into account is translators are exact. So sometimes what we do is one thing very common is in Spanish, we don't put the tildes. So if we don't put the tildes in Spanish, the translator is not going to translate correctly. And sometimes we think it's the problem or the fault of the translator, and it's not the fault of the translator, because
ah,
there it has a different meaning. An example, if I say, let me say patio, right? If I say the word patio in Spanish, right? If I say like this, patio, the past of patear, right? If I go to the translator and I put patio, if I put it without the tilde, it's going to translate patio like a yard, right?
yes.
So sometimes we say, okay, it's the problem of the translator, and it's not
Oh,
necessarily the problem of the translator. Look,
yard, yes.
and this is a mistake, but patio, this is the incorrect one, but that's what it should do. It should be an example, el patio or something like that. This is incorrect, but it should be like this. So obviously when we put the tildes and the pronunciation and things, sometimes it helps me with that, because sometimes we think, oh, it's a problem of the translator, and it's not necessarily. And because translators are machines, but we have to know how to use the machines. And what your teachers say in university, they can be very valid and very correct. We shouldn't use translators to translate full sentences or very long words or very long paragraphs. But for specific words or when I have a doubt, we can do it. And what translators can do is they can show me if I'm doing something correctly with the grammar or with the order. An example, if I put a sentence in English in the translator and the translator gives it exactly how I was saying it, that means it's correct. Obviously, if it changes one of the words or something, I have to look if maybe I forgot the tilde or the accent or something, or the order or the spelling. Sometimes can happen. So basically that's it, because sometimes we say that translators are not as good, but I use them. I use them, but I always have to be careful with how I use them, because I don't
Okay.
necessarily use them 100% to translate everything. No, I use them to translate specific words, technical words, but with the technical words, I always do like a second step to the translation, which is the one I showed you, which, okay, I found the word. Now I have to put it in the context. If I am able to put it in the context and the context gives me the correct definition, or I read what it's talking about, then I know that the word is correct.
Okay, okay.
Mhm. Yeah, but
Thank you.
don't
Yes.
never don't be afraid to use a translator, or don't distrust, or it's important. You can distrust, but you have to have like a second verification process, and that's the second verification process you can have. If you say, maybe the translator is not giving me the word that I'm thinking about, okay, put it in a sentence in English, and in Google is going to tell you if it's correct or not.
Okay. Okay, thank you, Juan David, so much. And I'm sorry, I didn't remember to pay you the last class, and I pay you today.
No,
Sorry, I
no,
remember today.
no. No worries, Sophia. Don't worry, for me, it's relax. It's not necessarily. If you ever want to change the payments, you want to say, I want to pay you once a month or every 2 weeks or every week. For me, it's however you want to do it. It's no problem.
Okay, thank you so much. You are so kind.
No worry. You did an excellent job today. Very good. Very technical things that we learned, and it's very, very nice. The same thing that I said to you last week, be a little careful of the correspondence between singular and plural. Sometimes you are confusing some of the words, the to be with the singular and the plural, but that's something that you do speaking a little bit more. But that's like the smallest correction that I have, but that's the rest. Obviously new vocabulary that we learned, and you describe the medical symptoms and things excellent. You are very clear in your explanations, and that's very important. Obviously, when you want to think about what you are going to study, maybe when you go to another country, being able to describe these kind of symptoms is okay. And obviously, the technical vocabulary is easiest, I consider, because obviously you can just look for it in a medical dictionary or something, but actually like trying to explain them in a common, like everyday manner or everyday language is something that you are doing, which is important, because you have to explain to me, like, I don't know, because obviously I'm not a doctor, but the descriptions that you are giving me of the symptoms and the signs and the treatments is excellent, because that means how to simplify something that is technical.
Okay, thank you. Yes, and for the other, like for the other class, like I prepare something or what?
Yeah, if you want, you can prepare one thing. You don't have to prepare two. And in the next class, I was thinking in talking a little bit about the future. So asking you some questions
Okay.
about the future so we can
Yes,
practice the future tense. Okay.
yes,
All right.
that's wonderful. Okay, thank you, Juan David. Have a
Yeah.
good day.
My pleasure. Have a good day. See you next week.
Bye. Thank you.